Severe acute respiratory syndrome. Severe acute respiratory syndrome (SARS) is a viral respiratory disease of zoonotic origin caused by the SARS coronavirus (SARS-CoV). Between November 2002 and July 2003, an outbreak of SARS in southern China caused an eventual 8,098 cases, resulting in 774 deaths reported in 17 countries, with the majority of cases in mainland China and Hong Kong. 9.6% fatality rate, according to the World Health Organization (WHO). No cases of SARS have been reported worldwide since 2004. In late 2017, Chinese scientists traced the virus through the intermediary of civets to cave-dwelling horseshoe bats in Yunnan province. An epidemic of SARS affected 26 countries and resulted in more than 8,000 cases in 2003. Since then, a small number of cases have occurred as a result of laboratory accidents or, possibly, through animal-to-human transmission. Guangdong, China. Transmission of SARS-CoV is primarily from person to person. It appears to have occurred mainly during the second week of illness, which corresponds to the peak of virus excretion in respiratory secretions and stool, and when cases with severe disease start to deteriorate clinically. Most cases of human-to-human transmission occurred in the healthcare setting, in the absence of adequate infection control precautions. Implementation of appropriate infection control practices brought the global outbreak to an end. Signs and symptoms. Initial symptoms are flu-like and may include fever, muscle pain, lethargy symptoms, cough, sore throat, and other nonspecific symptoms. The only symptom common to all patients appears to be a fever above 38 degrees Celsius (100 degrees Fahrenheit). SARS may eventually lead to shortness of breath and pneumonia, either direct viral pneumonia or secondary bacterial pneumonia. The average incubation period for SARS is 4 to 6 days, although rarely it could be as short as 1 day or as long as 14 days. The distribution is based on the 2002-2003 epidemic. The disease appeared in November 2002 in the Guangdong province of southern China. This area is considered as a potential zone of re-emergence of SARS-CoV. Other countries, areas in which chains of human-to-human transmission occurred after early importation of cases were Toronto in Canada, Hong Kong Special Administrative Region of China, Chinese Taipei, Singapore, and Hanoi in Vietnam. Prevention. There is no vaccine for SARS. Isolation and quarantine remain the most effective means to prevent the spread of SARS. Other preventive measures include hand washing, disinfection of surfaces for fomites, wearing a surgical mask, avoiding contact with bodily fluids, washing the personal items of someone with SARS in hot, soapy water, eating utensils, dishes, bedding, keeping children with symptoms home from school. Simple hygiene measures. Isolating oneself as much as possible to minimize the chances of transmission of the virus. SARS is most infectious in severely ill patients, which usually occurs during the second week of illness. This delayed infectious period meant that quarantine was highly effective. People who were isolated before day 5 of their illness rarely transmitted the disease to others. Treatment. Antibiotics are ineffective, as SARS is a viral disease. Treatment of SARS is mainly supportive with antipyretics, supplemental oxygen and mechanical ventilation as needed. Antiviral medications are used as well as high doses of steroids to reduce swelling in the lungs. People with SARS must be isolated, preferably in negative pressure rooms, with complete barrier nursing precautions taken for any necessary contact with these patients, to limit the chances of medical personnel getting infected with SARS. Some of the more serious damage caused by SARS may be due to the body's own immune system reacting in what is known as cytokine storm. As of 2020, there is no cure or protective vaccine for SARS that has been shown to be both safe and effective in humans. According to research papers published in 2005 and 2006, the identification and development of novel vaccines and medicines to treat SARS is a priority for governments and public health agencies around the world. It is reported in early 2004, an early clinical trial on volunteers is planned. References: www.wikipedia.com, www.who.com. Visit FB page. Emerald Ticketing Services smiley face. To God be the glory.